Hi, everyone. Dr. Danielle Meadows here, and I'm on with Dr. Ron Davis today, the director of Open Medicine Foundation's Collaborative Center at Stanford University. This is just an informal chat with Ron that's part of our efforts every May to raise awareness on ME/CFS and related conditions. Ron, one of the things that I have found so inspiring about conducting research in ME/CFS is the passion that you can feel from everyone in the community, whether they live with the disease, care for someone who does, or are working to solve this complex problem through research. And you are certainly no exception to that. So I was hoping you could just share where that passion comes from for you.
It comes from, I think, maybe two sources. One of them is that you recognize by working in the disease and actually having patients come in and say donate a blood sample or something, you get to meet patients. And then I also run a meeting where patients can come to. So there's a lot of interaction with patients, which I think may not be true for a lot of researchers studying other diseases. And you talk to them about their stories, and I don't know how you could not be incredibly sympathetic with what their struggles are. It does actually make you want to work harder and become very impatient with bureaucracy that keeps you slowed down. I'm having a lot of bureaucratic stuff thrown at me right now, and it's making us very slow, and I'm really upset about it. But the bureaucrats don't know that. They think they're doing a good job. Anyway, in the research, I try to keep it as cheap and as simple as possible because that means we can do more, but also worry about the accuracy of it and make sure that people are trained how to do good experiments. And I have a great group of people that are really good at research and very knowledgeable of all the stuff that's done that's wrong. And they don't want to do something that's wrong. So they're very careful. So I'm very blessed with that. It's not a big team, but I wish it were double or triple because we could handle that. But that's where the passion comes from, and in the sense that the patients are suffering a lot. And even the ones that don't have it very bad it really impacts their life. Even the ones that can work part-time. And it isn't one of these things that, oh, in a few months you'll get over it. No, you won't. We got to figure out how to get people over this. And the really good news is, in knowing two people that have gotten over it, one of them was actually came to the lab and we've been working on her case a little bit, have gotten over it. And I had a graduate student who came down with it very severe and she got over it. And she's normal. It's not like a lot of damage has been done to the body. And that's a little surprising. A lot of diseases, you can get healed, but there's a lot of leftover problems that you have. And in fact, these people are all being very active because they hadn't been able to be active before. And they go running. My graduate student runs 10 miles a day.
That's amazing.
Yeah.
Yeah, you're right. The passion definitely increases every time I have a conversation with another patient.
Yeah.
Like you said, I don't know how you could turn away from that once more about it. And I think that story about some of the recovered people that you've heard from is really incredible. And one of the things I wanted to ask you about is if you could share a message of hope with the community. And I think that's a great start to a message of hope
Yeah, and I think they feel
out there.
that they'll never get over this, and if they do, they'll still have some problem. And the evidence is no, there's something locked in and it keeps this disease going, and we can just unlock it. You're normal, absolutely normal.
That's wonderful.
And I think that's something they should have hope for. We got to find a cure for this. Not just a treatment that makes you feel a little bit better. That's okay if you find it. Nothing problem with that. And I don't object to people working on that necessarily. But overall, as a community, we've got to cure this disease.
Absolutely. We're all about getting people better. That's the goal.
And then they can go back to work. They can have their life. Can have their social connections and so forth. I get a lot of that from my son because he's bedridden and he'd been sick for a long time. He's been very severe. And we had a real scare with him recently where he had to go to the hospital and because he had a bacterial infection,
Yeah.
blood infection. And he had blood clots in his lungs and he has blood clot in his heart. And the emergency room doctors thought he would die. They didn't think he would recover. And so that was a real scare for me. And that can happen just all of a sudden.
Yeah, it's very frightening. And I think about Whitney often, and he is one of the many that we're working for.
Yeah. And he was in the hospital for almost a month
Yeah.
because they didn't want to release him while they had the blood clot in his heart. So they kept doing scans on him to see whether it had, they expected to dissolve eventually, and eventually it did. He was on blood thinners, but it took a while. And they
I'm
wanted,
glad he's back home now.
yeah, but by being in the hospital and all the hubbub in the hospital and being so sick, he's not doing that well. But hopefully he'll get better.
Yeah. We all hope that.
Yeah.
And thank you so much for all that you do for the community, both for your son and for everybody else. I know that it means a lot to a lot of people, and the work that you're doing is so important. So thank you so much, Ron.
Yeah, and we also have to make sure we communicate this to caregivers and family members who think that there's nothing wrong with them because it doesn't look like there's anything wrong with them. They're just lazy. And I think a lot of patients have that additional problem of only being sick, but having disbelief amongst their friends and family. I know my son said he lost all of his friends that he had before he got sick. And I understand, he said he understand that because what are they going to do? Come in and watch him sleep? So he understood it, but it nevertheless it was very hard
Yeah, it takes a toll for sure.
not having because anyway, he's trying to make friends now, new friends, but they'll be basically, I guess, Zoom friends. So you can at least see them and talk with them and have a meeting and from your bed, and he's and somebody else that's also in their bed. But that would be a good thing for the patients to figure out a solution for how to generate some more friends, and
Yeah.
when they're only able to deal with it.
Yeah, like you said, we're hoping to help combat that disbelief as well. That's part of what May Momentum, this MECFS Awareness Day is all about, is making sure that people know that this is very real and it is very debilitating. And we have to reach out to those that are suffering from this. And on the research side, work as hard and as fast as we can to get them better.
And the other thing I find is that almost unanimously, all the researchers are very willing to collaborate and share their ideas, share their results, including the doctors that work on this. They also are willing to participate and try to help figure out what this disease is about. That sympathy
Definitely.
runs deep in this community.
I think it's unique, and I don't know that it exists in many other fields, and it's very refreshing.
Well, yeah, a lot of other medical fields are very competitive amongst the people. This does not seem competitive.
Yeah,
It's they're delighted if they're able to help.
exactly. Yeah. Great. I think we will wrap up there. So thank you so much for just having a brief conversation with me, Ron. I really appreciate it.
Sure. Great. Thank you.